nursing instead if being a cop doesn't work out.
Welcome. Okay, who else? Come through, guys.
I'll go next. My name is Nola. I am a freshman at Hunter College. I graduated from New Utrecht, and at Hunter I plan to major in biology with hopes of becoming a pediatrician. But nursing also does catch my interest because I also am the type of person to widen my perspective and expose myself to different fields to have a good idea of what I actually want to do in the future. So it's nice to meet you all.
Thank you.
Anybody else wants to go?
Hi guys, my name is Della Cruz. I'm actually a dentist, licensed dentist, graduated last year, but I know a lot of my friends who want to be in the nursing field always ask me questions regarding, what to apply to, what kind of information I can give them. I usually have no answer at the time, so I just found this to be interesting just to gather some information for myself to share with others.
Great. Hi, Della Cruz. Welcome.
Thank you.
Hi guys, I'll go next. My name is Malika. Hi Nilufar, if you don't know me. I'm currently a student at NYU nursing, and Nilufar is the one who helped me to get into this program, and she's really the biggest inspiration for me. And now this is my actually second semester, so I'm in the accelerated program, so I thought I should join and it will be interesting.
Great. Thanks for joining, Malika.
Who's next? Don't be shy.
My name is Roshana. I go to Baruch College. I'm a freshman. I am currently majoring in marketing management. And the reason why I'm here is because I want to expose myself to the field of nursing because I'm still not sure like what will be my final choice of major. Yeah. Nice to meet you.
Welcome, Roshana.
Hi.
Hi everyone, my name is Shamina. I'm a junior in high school. I'm from Philly, and I joined here to learn more about nursing because that is my intended major when I graduate from high school.
Nice to meet you.
Hello everyone, I can go next. I'm from Philly too, and I am currently a third year dental student. The reason for me to join was I just found out the Uzbek society that was in New York. We don't have such thing in Philly, so I was like, wow, they're like, this is so much fun. I just wanted to join and meet you guys. That's all.
Great. We have two dentists here.
Yep.
Don't be shy, guys. Come through.
I guess I could go
Please.
next. Hello, everyone. My name is Ikhtiar, but people in America just call me DJ because nobody really
Hi,
can say
DJ.
my name correctly.
What's on your nose, honey?
So I am a first-year Master's of Public Health student at CUNY Downstate. My concentration is in epidemiology. The reason for me joining in here is that I am passionate about the work of medicine, and I have great response volunteering at a hospital, learn even more from our own Uzbek nurses. I'm excited to be here, and nice to meet you all.
Nice to meet you, Ikhtiar. By the way, if you guys want to introduce yourself in Uzbek or Tajik or any other language, that's okay too.
We really do not bite. We're very small people.
Nilufar, salom. من گلناز ما شما که قبض دادم
السلام عليكم.
استنبامي
Aha.
قبض آزوش من گفته اكو همه گوش کسیم همه انگلش به قبض ایساس
Çin'e benim alo. Aha.
انگلش هم پرفکت نه اوکی خیلی
نه.
مشغول گوش کسیم فهمیدم من international nurse O'zbekistonda Tomskadagi колледжа ай hozir hay заниматься кайсем همین маслихат дар кор буд бо чӣ кадан дар кор чӣ хелен тесто кадан дар кор конфьюз мешуд одам ҳама материал ҷудо мӯл барои ҳамон шумо мондетон ман маслихат дар кор буд
Hozir نقص همین سوال پیش دیگر نقص همه جواب می همه با یک دم همون سوال شما بود دیگه دیگر رو بهم باشه دیگه با بهم جواب میشد so translate میکنم for those of you who don't speak Tajik she just had a lot of questions and she was just confused about how to get into nursing and all that so I think it's a great place because some other people might have the same questions and confusions so we'll be able to get the answers today hopefully.
Hi everyone, I'm Gulnaza and I'm a freshman at Hunter College. Currently, I'm on the pre-nursing track and becoming a nurse has always been my dream career because I enjoy learning about medicine and I love helping people. Thank you.
Great, welcome Gulnaza.
Thank you.
Okay, I guess I'm not sure if everybody's done.
No, we have a few more who haven't introduced themselves, but they're welcome to speak up at any point in time.
Yeah.
I can introduce myself. I kind of did, but I go to Columbia. I graduated from Brooklyn College with psych and bio, and I went on to get my master's in nursing at Columbia, and I'm currently pursuing my nurse practitioner doctorate degree. I'm in my second year. I'm doing clinicals and I work at Mount Sinai. I haven't been a nurse as long as Nilufar. I just started during COVID. So that was hell. She knows absolutely what I'm talking about. And even as new nurses, older nurses, it's hell. But yeah, ask questions. You can private message us too if you want. No pressure. We will answer any questions.
Okay, I am. So how do we do this? Do you guys want to just, I don't know, raise your hand and ask questions, or should we just go about like, I don't know, quick introduction to nursing field, how to get into school, the prereqs, or what is it like to be a nurse, a day in the life of a nurse, or just the school? What are you guys most interested in, or what are your questions? Maybe just either raise your hands, or maybe Akmal can ask questions.
I'm sure you guys have a lot of questions, so I'll hold back for some time. But not everybody introduced themselves. Intizor, Sadakat, come on. Roxana, Shahnoza.
Hi everyone, assalamu alaikum. I just joined. To introduce myself, my name is Intizor. I go to Hunter College. I'm a fourth year student. It's very nice to meet you all and to see you again for some of you. What else are we saying?
What's your major, Intizor?
Human biology.
Okay, great.
Are you planning to apply to Hunter Nursing School?
No, I'm actually pre-PA, so
oh, congrats.
Thank you. Should I add anything else?
If you want. Everybody's welcome to say anything they want. We are the non-judging participants.
I actually had a question, Malika, when you were speaking. So you said you went to Brooklyn College, you got your psychology and biology majors, and then you went into nursing. Because
I was taking prereqs. Sorry.
Don't you have to be a nurse in order to go into the program? No?
No, the thing is, while you're in college, you can major in anything you really want that goes along the lines of for PAs, dentists, physicians. As long as you take the prereq classes, you can major in anything. Like you can major in Spanish, you can major in theater. As long as you take the classes that are required by the program that you want to apply to. Or, some programs want a little more, so maybe you can want to take a little more. That's when you apply. That's when you take the classes and just go ahead and apply to nursing school, dental school, PA, med school. It's whichever you want, as long as you got those prereqs and you have that competitive GPA and that personal statement, right, Nilufar?
Wait, to go into nursing though. But can you consider nursing as and your master's in nursing? I'm sorry, I'm like a little.
So I guess it's a good topic to start. So we can talk about how to get into nursing. Like, what do you do? What's the first step? I can go first if you want, Malika. Then
go ahead. Yeah,
just
go
take
ahead.
turns.
Yeah.
Okay. So how to get into nursing? Let's say you're in school, you have no idea how to get into nursing. The first thing, obviously, you do is research, right? So based on where you are, you just look at the universities or colleges, schools around you, and go into their website, check their nursing program, see their requirements. Like that's the first thing you do, and kind of compare with the classes you're taking, what's your based on what your major is right now. Just compare their requirements with what you have already. If you don't have anything, you just start taking them one by one. I always tell people to call the academic advisors, because that's how I started. They're great. They help you. Let's say you just choose the school next to you, like close to your home, and then call the academic advisors. They can meet with you, or I guess the first thing you do is just go to one of the nursing open houses. Then they go through the entire program, the requirements, the program details. Then you compare their requirements with what you have. That will determine how long you have before you get into the nursing program. Some schools have nursing exams, entrance exams, some of them don't. Some of them require more classes, some of them less. But I guess back to Intizor's questions, to take the prereqs, like pre-requirements for the nursing, you don't have to be in the nursing major. You can major in anything and take the classes. As long as you complete the required courses to get into the nursing field, you can do anything. You can do any major. You can become a psychologist and complete all your nursing requirements and get into the nursing program in that college or university. Do you want to add in more, Malika? About
I think you covered it. I think you covered it, honestly. Also, some colleges, I was a transfer student at Brooklyn because I went to Hunter first. I went to Hunter my first 2 years. And because Hunter didn't give me the chance to take the classes I wanted, I did. I took classes at Brooklyn College and then I transferred out. It's helpful if you are trying to get classes and you can't find them on your own campus. Find the ones that match the credit amount that your college or home college accepts if you're within the CUNY system, and just take it. Like some classes are easier like in a different college than your own college. Like I took Chem 2 lab because I couldn't take Chem 1 lab because I didn't have a chemistry lab class at Hunter. So just, you know, widen your options, make sure that like CUNY is on your side, except sometimes Hunter, you know, screws you over. You know that. It's a hierarchy over there. But yeah, you can just, I took chemistry lab class in Medgar Evers, and it's still counted into my courses. But it just means that you have to, when you are sending your transcripts to the schools that you have applied to, you have to request your transcripts from each of those schools. Like I requested from 3 schools, like for my transcripts.
Yeah,
so make sure
so
you're
it's a little
thorough.
more work. It's a little lengthy process than your traditional route, but like Malika said, it's totally doable. Also, Uzbek, agar o'zbek tilida ham kamgina qisqa qilib aytishni xohlasangiz shuni qilishimiz mumkin, qisqagina. Agar ingliz tili anaqa bo'lmasa agar ba'zi joylarda qanaqadir tushunmovchilik bo'lsa agar o'zbek tilida ham ozgina gapirib o'tirishimiz mumkin. So I guess everyone's okay with English. So I didn't do traditional route. So I did my medical assisting degree first. So I went to ASA college for about 2 years. I became a medical assistant first. Then I went to Hunter to take my prereq courses. I took my entire prereq courses at Hunter because it's a good school and it was way more cheaper than the private school. Then I did all my nursing courses at NYU. So it was the best route for me. I actually recommend this to a lot of people. If you want to go to private schools like Columbia or nursing school, you can do all your 100% of your prereqs at one of the CUNYs or SUNYs. Then you can go to private school for just your nursing classes, which are, I believe, 3 to 4 semesters or more, but usually 4 semesters, just nursing courses. That way it's much cheaper, and all of the CUNY prereqs are transferable to any of the private nursing schools.
Quick question. So like I said, I'm completely different, and I know it's bad, but I'm taking psychology classes, and I was thinking, how long will it take for me, after, let's say I take my major in criminal justice and psychology, and then I want to apply to nursing school. How long do I have to be in nursing school?
How long you have to be in nursing school?
Well, the nursing program.
Oh, it varies.
Based on your classes, as is. I mean, prereqs.
Yeah, you're asking whether how long you have to be in school to take the prereqs, or how long you have to be in school to become a nurse.
To become a nurse.
Okay, well that varies as well. Within New York City, we have various programs. There's NYU's 16 months or 15 months. What was it?
15, 1-5.
15, yeah. Mine is the same way. They're 15-month accelerated programs. We have NYU, we have SUNY Downstate. There's also Toro. I think Toro is also 15. I'm not sure.
What about, I heard CSI has a great nursing program.
CSI has a good nursing program. Wagner has a very good nursing program. Columbia is pretty good. It's just, yeah, it's just a lot of work.
And when you say
adding a master's.
Oh, sorry. When you say prereqs, do you mean for the college in general, or for the nursing program?
For the nursing degree itself, you're taking prerequisite classes within your bachelor degree.
Yeah.
Sometimes outside of your bachelor degree, sometimes the classes you take also apply to credits within your degree, but they also add on to your prereqs as a nurse, for nursing school.
Got it.
Yeah, and because they have to accept the courses that you take, because sometimes some colleges do not take associate level courses, some schools, but that's like sometimes, majority of the time, as long as you took the credits, you're eligible to apply. As long as you have the GPA, you can apply. Yeah.
So Aziz and everyone else, so this is how it works. I'm going to give like a very simple example. To get into the nursing program, let's just say NYU requires 10 courses, 10 prereq courses, right? As a psychology student, you took 7 of them and you finished your degree in psychology. So you just have to take those, like even if you have your psychology degree, you just take those 3 remaining courses and you apply. Then you only have to do nursing. So you just have to have those 10 required courses before you get into nursing. So those are non-nursing courses. Those are non-clinical, non-nursing courses like psychology, nutrition, sociology, biology, some science courses, math, statistics, and stuff, right? So NYU may require 10 prereq courses, Columbia may require 12, some schools may require 8. So you just have to like compare what you have with those schools. So based on what you have, that kind of determines the timeline. You know, this is all before nursing to get into the nursing courses. You just have to complete all those required courses. Then you get into nursing. Then I guess the nursing itself, it differs. Like Malika said, NYU has 15 months. Columbia, you said 15 months too, right? So that's the nursing itself. Then you take your exam. Then you take your license and degree. So that's like next step. Any more questions?
Do we need to do, hi, I'm sorry. My name is Guljahan and I had one question. Do we need to do any volunteer work to get into a nursing program or it's not necessary for?
Okay, about volunteering. If you know 100% that you want to become a nurse, if you have someone in your family that inspired you a lot, you know that this is the only thing you want to do, you don't have to. You just have to get good grades, good prereqs, then you will get into nursing. But if you're not sure, you know, what nursing is, like what nurses do, I wouldn't take any of the prerequisite courses unless you're sure that you want to be a nurse. You know, just go volunteer somewhere, talk to nurses, work with doctors and nurses, even for a very short period of time. And you do that by volunteering. I strongly suggest doing that before nursing school if you're not sure nursing is for you or not. I wouldn't, that's like that was the biggest thing I was going to mention in this meeting. If you're not sure what nursing is, if you're not sure what you want to do, definitely go volunteer, do, I don't know, like internship or talk to people. Don't take prereqs because nursing prereqs are a little, you know, too specific to nursing. I don't think you can apply them to like a lot of majors. So before taking prereqs, which can be lengthy and difficult, you have to be sure nursing is for you. So in that case, I would do volunteering, but other than that, it's not like it's not required. Maybe it will make you a little more competitive to get into nursing school, but that's not one of the required, you know, checklists to get into nursing program. I didn't do any volunteering, so I got it.
There's questions in the chat. I don't know if you guys can see them.
Yeah, I just thought I was gonna bring it up to Nilufar right now. We have Roxana Yahyayeva. She has 2 questions for us. She is asking, are you happy with the quality of education you received in the private schools like NYU and Columbia compared to CUNYs? And can they, as high schoolers, volunteer?
You want to go first, Malika?
You can go first.
I was happy. I was very happy with the quality of education I received at NYU. But like I said, I still recommend you doing prereq somewhere else, just because of the tuition. Do the prereq somewhere else, and the actual nursing courses, do them at NYU. I was happy. I was very happy. if you did have the option of staying at Hunter or any other CUNY schools, public nursing for your colleges, do that 100%. But if you run out of options, but because of your prereqs or timeline, then I 100% recommend NYU.
I was happy with my education at Columbia. It was definitely a trip and a lot of crying because it's so hard. Because your whole dynamic changes with like how you study and how you have to understand things, how you have to use your critical thinking from what you've done as a college student is completely different than what you've done, like what you're going to be doing in nursing school. And I was really happy about it. I'm still happy about where I am, and I mean, every school has its own challenges. Mine has a lot of challenges too. With COVID, they had to go remote, and a lot of students didn't get their clinicals, so they didn't get enough of the experience, but they're making it up now. I was happy, but I agree 100% with Nilufar about taking the courses at CUNY. Like, it saves you a lot of money. I was debt free for my bachelor degree, but I'm in debt now. And yeah, that just take it easy, get your prereqs out of the way. If you want to go that private school route, it's up to you. If you want to transfer to a private school, it's always also up to you. But save money because parents are going to be on you.
I think somebody wrote questions. Can't see them. Oh, yeah, we have questions here. Okay. Are you happy with the quality? Okay, I guess we answered that. The volunteering one we answered. Okay, a question from Gunosa. I know that working as a nurse can be very challenging. Can you give us an insight on how you manage your career and personal life?
I want to laugh at that one.
You go first, Malika. Mine is a little more complicated.
Yeah, I have no life, guys. I'm just letting you know. I have absolutely no life. Kidding. I have these guys here. I have my Uzbek society to support me through it. They've been very supportive, and it's definitely a challenge. And I work nights, and I go to school on Mondays online on Zoom, and I have clinicals during the day, like the days that I don't work. And it's very hard to manage that time, like to give time to my friends, to my family, to myself, because mental health is extremely important to maintain, because if you burn out, then you're gonna spiral, and it's not healthy for you. It's not healthy for when you see your patients and how you take care of them, and it's not good for your grades if you're in grad school, like if you continued on. I'm just managing those three things at the moment, and I'm finishing my second first semester, my second year, with going into clinicals with 240 hours, and that in itself is hard because, guys, really, I just want to sleep. Most of the time, I just want to rest and gather my thoughts, because it really, really drains you. Like what you see in those rooms, like you can see death, maybe you see birth, like if you're in L&D, and sometimes you can see the craziest thing ever. My 3 nights were interesting. But just take it easy, step by step, and hydrate, please. Hydrate yourself. I'm trying to hydrate myself, and make sure to always like it doesn't matter to have like a personal life with like friends. Like they do matter, but you have to put yourself first. Um, I I know Nilufar has kiddos, very cute ones, by the way, very cute. Um, so she has more on her plate than I do. So I admire her for that. So yeah, we're all in different spheres.
Thank you, Malika. Actually, your work and life balance seems more complicated. I forgot the fact that you're in grad school. Actually, that can be tough with the clinical hours and personal life and all that. So I'm not in school, so it's relatively easier for me now. But I can with grad school and you're full time, right, Malika? I guess, right?
Yeah, I'm completely full time.
Yeah, so full-time student, full-time nurse, for your own personal life. It's a lot. So I'm in school. I'm working full-time. So that's for those of you who don't know, nursing in a lot of places is three 12 shifts, right? Three 12 shifts a week. So you only work 3 days a week. In a lot of places, you can choose your schedule. I choose my schedule as Monday, Wednesday, Friday, so 3 times a week. So I'm home 4 days with my kids. I know it seems like you only work 3 days, but with that 12 hours, it can be really challenging. You need the next day, like a full day, to recover from that first 12 hours. Like Malika said, we see a lot of stuff, from birth to death, a lot of stuff. So you need to be able to leave your work in the hospital, come to work, ready for your family, for your kids. In the beginning, that was a struggle for me to leave work at work and to leave family at home. It was difficult, but over time, you just get better. You just become more resilient. You learn. But in the beginning, it was tough. Especially during this COVID, it was like extremely challenging for me to not bring work to my family. But with career and personal life balance, I guess as long as you just have to really do good time management. You need to have a lot of support from your family, especially for those of you who have kids. As long as you have a lot of support from your family, and if you have good time management, good prioritization, this is all about working. I'm not talking about nursing school. You'll be fine. So support, time management, prioritization, hydration, very important, and just taking time for yourself, taking care of yourself. But kids, school, and full-time working, I think that's like next level. I don't even know how I'm going to do when I'm in school, but that's going to be way more work. But I guess, did we cover any
You're
more
gonna
questions?
do great. You're gonna do great. You've done this for 5
I guess
years
I have
now.
I will have no other choice.
Are you planning to go back to school?
Yes, 100%.
Very nice. Can I
think we had a question.
Oh, sorry. Can I ask what specialty you guys work in?
Oh yeah, absolutely. I think we forgot to mention that. So I work in GI colorectal surgery 4, which can sometimes also be med-surg. It's like a mix of everything. So I'm gonna call it a medical surgical acute 4. So we get a lot of acute patients most of the time after the surgery, and our surgery specialize in colorectal and IBD, gastrointestinal related surgery. So a lot of patients come to us after the surgery. So these are extremely complicated surgeries. So these are not like same day surgeries, like, people get their procedures done and go home. So obviously the people who after very complicated surgeries come to us. So we have to help them, hemodynamically, just recovering. We have to help them for the next few days after their surgery. stabilize them and send them home. So we get a lot of post-operative patients, like after surgery. So medical, surgical, acute patients come to our floor.
I work in absolute medical surgical floor. It's just, we get everyone, legit everyone. They just throw them at us. Kidding, they kind of do, but we deal with psych patients that have medical conditions. We have post-op that can't come from PACU. We have like ortho, GI, like she said, like they're more specialized in the GI. We get the COVIDs also. We have separate rooms for them. We have altered mental statuses, like when patients don't really know where they are, that maybe they don't know who they are, or they don't know their date, or they're just, they're completely just shut down. We have vents, like we have patients on ventilators, we have patients on like with trachs, everything like COPD, we give them the BiPAP machines. Oh my gosh, those BiPAP machines beep so much in Nilufar. I can't stand the beeping. Oh my God. And it's a lot of, you really have to be careful with patients, like, because there's always going to be a change in status. Like you can't predict when a patient is gonna go, when their status is gonna go rogue. So you always have to keep an eye on them. Like last night we had a rapid and all hands on deck, the whole entire, staff, like the nurses, like you go running there, you support your nurse, you go and you help because you gotta get that patient back in balance. So we deal with a lot of instability. It's a lot of acuity, like very high acuity. And we have patients on contacts. Oh my God. Sometimes we have people with lice. It's kind of gross. But yeah, in general, we just deal with every population that, yeah, everything that you need. We're called the OG med surge of the hospital.
Oh God.
And
yeah, that was my first floor actually, and I'm so happy they specialized the floors, they separated. So the first year, actually it's second year, I was there. It's basically everything and anything, any age, any condition. I mean, not pediatrics, but like any adult age.
Yeah. We had like
with
somebody young. I
Yeah,
think the youngest we had 23.
Oh no, we had 18. So I guess between pediatric and adult, like you're almost adult.
Yeah.
You're too big for pediatric, but you're almost adult kind of age.
Yeah. You know how they start wandering around and you're like catching them, like, where are you going? Where are you going? No, you stay on the floor.
So that's why, guys, I get a lot of messages, right? In Instagram and Telegram, people ask me nursing questions. A lot of people ask me, I'm not sure, I'm considering nursing because everyone says it's great. I don't know what to do. That's why I say nursing is so special. There's a lot of human to human interaction. You can't, I don't want to say things about other, other fields, but it's not just you become a nurse and then the next year you don't like it and then you just give up and go do something else. It's so special. You have to be meant for nursing, you have to be a special person for nursing. I always say that, but as Malika is saying, there's just so much things. It's so stressful. Sometimes you just cry, you just scream it out. But at the same time, it's extremely rewarding. But you have to love what you do. This is not something you just come, do your job, get paid, and go home. You have to be meant for this. You have to love what you do. You have to love people. You have to love helping them. You have to connect them in a very special level. You have to understand them. You have to feel their pain. They die. People give birth. You experience that. People die. People scream in pain. You heal them basically. it's just so special. So I 100% recommend, if you're planning, if you're not sure if nursing is for you, go see what nurses do, just spend a day, a few days, go volunteer, shadow nurses. Just, you have to know what nurses do. Don't just go take prerequisites. I 100% recommend.
You said shadow nurses. Do I need any, like, because since I'm not in the nursing track, I tried volunteering, but like I'm not having any luck with like getting back to them.
Where did you apply for volunteering?
It's I don't live in New York right now, but I'm in Jersey, so I applied to work at different like hospitals, and then like they haven't like they I think they rejected me, but they trying to be nice about it.
When did you apply? Did you apply recently?
3 weeks, a month ago actually.
Yeah, here's the thing. Because of COVID, we do not have any volunteers on the floor whatsoever. We only have nursing students, and that's maybe 2 or 3 times a week. But that's even limited because they only limit it to 1 student. Because COVID is so, contagious and so dangerous. We do not have volunteers at this time, and I'm sure like my friend also volunteered at NYP, and they put him away. Like they told him like don't come because of COVID. So they're not gonna get back to you.
It wasn't like a volunteer, because like one of my neighbors, she works at a hospital, so she referred me to work as I think it was a nurse aide or something like that. That was like a patient like aide. You don't have to have like a degree in nursing at all, but I still haven't heard back from them. That's what I was wondering.
I mean, I believe maybe you have to have like some sort of training. I'm not sure about the nursing assistant. I believe maybe you have to have something of a prereq for that to be hired.
No, you need a certificate and certain, I'm not sure how long, but like a month or 2 of training for CNA. I think they call it CNA at some places. For us, it's PCT. It wasn't CNA.
No, it was PCT. That's what it was.
Yeah, PCT. They need, I believe they need 1 month of training. 1 month of, at least 1 month of training. You need to get your certificate and some kind of state licensing. There's a test that you have to pass, do some hours of clinicals. You do 100%. You need a certification for that. It's not like high school diploma, requirement. That's actually a good, for those of you who want to do something pre-nursing, like while in school, you can do PCT actually. PCTs work in hospitals. They work with nurses. It's a month or 2 of program, not long. Training, you get your certificate. A lot of hospitals need PCTs right now. So that's actually a good like starting level, step for you guys if you're considering nursing. But you need to
apply, please. We need guys over here. Please apply. We're mostly women on the night shift. So
the PCTs, Malika, or PCTs and nurses?
Yeah, we call them PCAs. Like
okay.
Yeah. We had our only guy transfer out.
Yeah,
but we need
people are transferring out.
Yeah, I can like check it out and see if we have any openings. Even also, did that answer your question, Aziz? Okay. We also have a few questions in the chat. It's either to me or to you, Nilufar. Did people help you pass the NCLEX, I believe?
Okay. Yes. Okay. There is a question. So let's do the NCLEX, I guess, then we'll go to the next question, right? I can start with NCLEX. It was fun. I loved NCLEX, the whole NCLEX process. So NCLEX can be in 2 different cases. For someone like me who studied here in the US, they basically cover the most part of the NCLEX in school. If you go to school here, at least NYU did, like they almost fully prepare their students for NCLEX. Like 99% people pass on their first try. They're very NCLEX, their program is very NCLEX focused, right? So in that case, after you're done, I believe it's the same for Columbia. A lot of, if you go to school here, they're very NCLEX focused. They train you, they prepare you for NCLEX. However, I know we have people whose like nursing degrees are not from the US, and I believe they just have to get their degrees evaluated and then study for NCLEX, and then they're able to get their license. In that case, you start reviewing the NCLEX course. NCLEX, you just have to, okay, first of all, you have to know your style. So figure out your style. How do you want to study? How do you want to split your time? Studying for NCLEX from zero is full-time job. It's like you need to focus. If you, this is for the cases of like not US, non-US NCLEX, right? So you have your degree from somewhere else. You come here, study for NCLEX. So see it as a full-time job. You have to review the contents. There are contents books. I didn't do any contents books, so I don't know. Maybe it's Sounders, right? Have you heard of Sounders, Malika? I think Sounders is a good one for the content review. And I highly recommend Kaplan. I did Kaplan for the entire thing. I like Kaplan because it's a huge book. I think if you purchase the course, the book comes with the course. Kaplan has contents and strategies and a ton of practice questions. So you need three things, okay? You need contents. You need to review your anatomy, physiology, pathophysiology, the whole understanding. So it's the contents. One, you need contents. Two, you need strategies. NCLEX is not a test that you just know anatomy and biology and you know the nursing information and just go and take it. There's a lot of strategies involved in that, and you definitely need practice on that. So three, you need practice. Practice. Lots and lots of practice. So if you do those three things, I recommend for starting from like zero. And Kaplan has a really good source. I'm not sure how much it is. I think it's around $400, $500, but I think it covers the entire thing.
Yeah, Kaplan was $500 for us because my school, they have like an agreement with Kaplan because they would be doing, you know how some schools do like ATI agreements, like Columbia has an agreement with Kaplan, and we do little exams for credit, like a percentage of your grade at the end of the semester for each of the clinical rotations that you go through.
Yeah. So I did Kaplan. That's why I recommend Kaplan. It was great. I'm not sure starting from scratch, from zero, I'm not sure how much time it takes. I'm gonna say like intense 3 months. Is that enough, Malika? I only had to study a couple weeks, but for like from starting from scratch, maybe like 3 months full time.
I mean, depending on like what your like speed is.
Yeah, where your level is. You're right. Yeah.
Yeah, like I did Kaplan. I did half of Kaplan, and I did half UWorld, and in total, I did like about maybe 4,000 questions. I was so exhausted. Shahrukh was there when I was doing my questions, when I was studying for my exams. I think so. Yeah, I think he was. Yeah, you were. Don't make a face.
Malika, that was your question. Did we answer your question? Malika's here. Maybe she left. Hey, I'm sorry. No, wait, we have another Malika. That was your question.
Yeah, I'm like, what? Yeah, but NCLEX.
Nilufar.
Labai.
Mamba вопросам has. Malika Всенко, UWorld kadam, Kaplan kadam. Mamba тоже Kaplan'la UWorld has, только man фамидани только тест кунам мукузарам, мани дана даромадам. NCLEX-га, когда ковид буд, ҳамон вақт ба даромадам. Ман только UWorld кайсем. Мана вопросам ҳамин ки только UWorld кунам мугузарам или больше вай тема гузаштаги мумкине?
Kelovligisini ham qilish mumkin. Chunki anaqa Kaplan ham anaqa Kaplanda ham tayyor bo'lasiz, Europe'da ham tayyor bo'lasiz, lekin anaqa xohlaganingizni olasiz-da, xohlaganingizni как бы вы выбираете.
У меня Каплан есть, только там вопросы и ответы. Это 2016 года книга.
Не, лучше компьютерную программу лучше покупать, потому что на компьютере, я, например, считаю, что на компьютере легче делать вопросы, потому что потом вам объяснение дают. Pastda объяснение bo'ladi, explanation. Kaplanniki juda ham yaxshi. Uworldniki ham juda ham yaxshi tayyorlatadi. Например, Uworld ko'pincha savollari prям formati Word NCLEX-ga o'xshaydi. Так что xohlaganingizni что легче брать, на какую программу, с которой вам удобно делать вопрос. O'shanga anaqa o'tiringda и усиленно тayyorlang o'shalarni. Немножечко запутываюсь.
А вы, девочка, не помогаете?
Я занималась 6 недель.
Девочка, вы не помогаете, чтобы passing the NCLEX? Как бы...
Такого нельзя.
Я имею в виду...
I think she means like preparing for NCLEX.
Да.
Мы не можем как бы... We can only advise you. Мы можем только сказать вам, что использовать, но стратегия для вас как бы будет совсем другая, чем для нас. Потому что, может быть, Nilufar делала побольше вопросов, чем я. Может быть, она побольше делала экзаменов. Я, может быть, еще больше делала, может быть, я вообще не делала некоторые дни. Это смотря как вы хотите. Смотря на вашу скорость.
Не, Nilufar. Энкас хаялamba mana просто man savolam haminki. Как учительница, как помогать нам кунитонно куфтани будама.
Авыздан кандаш азгар гейта?
Могу семки как учительница, как йоттодан, как инкас капамана фамидан, халина мокунитонно куфтани элакадам просто ман.
So she's asking, like NCLEX tutor. I think she's asking like NCLEX tutor. So unfortunately, I definitely plan to do this stuff. I love teaching the education part of the nursing. I love doing that. This is in one of my future plans to do tutoring, NCLEX tutoring. Not because I know Malika can't either because she's in school full-time. She's also working full-time. I'm working full-time. I'm also a mom full-time. So I have a big time constraint, with everything. I definitely want to do this in the future. Lekin man bilaman shunaqa bor NCLEX tutor bor. O'zim juda ham yaxshi ko'raman NCLEX yana qilishni. Hozir lekin men bilaman tutorlar bor. O'zimizda menimcha bo'lmasa kerak, lekin tutorlar bor. Eng zo'r yo'li shu praktis qilishda, shu savollarni qayta praktis qilish kerak. Shu bironta siz programmani sotib oling Kaplandan. Eng zo'r yo'li shu.
Meniki только Word bor, Kaplan yo'q. Только Word bor.
Menimcha Uworld o'zim shaxsan ishlatmaganman Uworld, lekin men eshitganman Uworld yaxshi. Uworldda content bormi yoki faqat savolmi? Savol-javobmi faqat?
Savol-javob и pastiga explanation bor обязательно.
Explanation. Shu Uworldni qilavering. Qayta practice qiling. Keyin bironta content kitob oling. Sounders masalan. Soundersda content bor. O'shani bitta review qilib chiqish kerak. Siz ana qiling, sizga o'zimda shunaqa resurslar bor. Men sizga jo'nataman emailga. Ko'p narsa bor menda emailda. Jo'nataman. NCLEX taalluqli.
Rahmat.
Xo'p. Mana yana savol bor ekan. Is it a good idea to take summer class to get your prereqs done and go in the program in the fall? Why not? Yeah, absolutely.
The thing is,
I guess
but
the only thing is the admission. I'm not sure if you will get to show them the proof before the school starts, right, Malika?
yeah, you have to have the prereqs done or in the process of completing them while you're applying, because they need to see your grades
By the time
before
you
they
apply.
make a final decision. Yeah.
That's the only thing.
Yeah.
Next question.
We have another question.
experience with-
It's more for you, I think, because I don't. Or actually, no, that's not for you.
I'm
It's
reading the
just
one
like
with the
for
children.
Beach.
Like children hospital, because I'm interested
Yeah,
in working with
yeah,
children.
because
Definitely was. Nope, I have no interest. I mean, no, I'm not that I don't have interest. I have no experience with kids. I have no pediatric experience, unfortunately, but I know people, they love it. You know, they love working as a pediatric nurse. I've never done it.
Yeah, I don't want to work on peace floor either. I mean, not because, you know, I don't like it, but I just never had the interest to be a pediatric nurse either. Like we have PNPs, like we have the pediatric nurse practitioners who are like loving it, like working and going through their clinicals, but I'm just like, I think I'll pass, because I did a clinical rotation on peds-onc floor, and seeing those children was like oncology cases, that just killed me. So I'm just like, no, peds is not for me. I'm just gonna go the adult way, because I can actually, you know, talk to them, because kids don't talk to. Kids do not talk to.
Yeah, also I'm a very emotional person, I think, when it comes to kids. So it wasn't for me. I think I'll just see kids with, you know, like after surgery, and I'll just sit and cry with them. They don't need someone to sit and cry with them. They need someone to help them, you know, heal, to entertain them. I can't do that. So I guess if you're too emotional, I did a rotation in peds too during school, one of my pediatric clinicals. And yeah, I would just cry every single shift, you know, every single clinical. So I'm too emotional for pediatric 4. But I know people who love it. They just love being a pediatric nurse. I think when you're a pediatric nurse, I think you'll just be there forever. You'll just be a forever pediatric nurse. So they love it.
And there's like the neonatal nurses too, like for the LND, like that's so, like I've been to the OR a few times, like for the C-sections, and those nurses are just like taking care of that baby.
Yeah, they're like this much. They're like this much babies.
They're just like so small.
Yeah. That's a very special floor too.
Yeah.
I think somebody answered that question for the tutoring, NCLEX tutoring. Mahala USA. Apparently, there's a group in Mahala USA that is apparently tutoring for NCLEX. Fazilat shared the number for, in the group chat. I'm not sure if everyone has access to that. They will have access to the chat, right? So if you go to chat, there's a number for Mahala USA. I think they're tutoring for nursing. I mean, sorry, NCLEX.
And there is a question, would you need a high school diploma to become a PCT? I do not know personally. I think it just depends on the hospital requirements.
You need a high school diploma, or wait, to work as a PCT or to get into PCT program? Would you need a high school?
I think to be a PCT, to become one.
You need a PCT certificate to work as a PCT in the hospital, and to do that PCT training, you need either high school diploma or GED. Yeah, you can't just work with a high school diploma as a PCT. That I know.
Yeah, and I think you probably have to like.
You need training. Yeah.
Yeah, and Aziz said that his pediatric nursing might be his calling.
Yay! We have future pediatric nurse here.
Hopefully, we see you there. Okay. Well, that's the chat questions. Did anybody get any questions that you want to ask now? You're welcome to. we are here.
I actually had a question, and I think it's important to kind of like shed light into this topic. And that is, you guys mentioned facing death at work. And I want to know, as we know that death is inevitable, I want to know, how did you guys, or like, did you guys face death at work? And how did you guys kind of like dealt with it? And what coping mechanisms or strategies did you guys come up with?
Nilufar, you can go.
Okay,
Wow.
so I had yeah, that's a very difficult topic, obviously. So before COVID, let's talk about before COVID. Before COVID, I had two deaths, right? Two for the past like 3 years before COVID, and they were both very like anticipated deaths, like 90. I don't know, the first one was like 98-year-old guy, I think. The second one was also in 90s. So that was very anticipated. We, we knew he was in hospice. If you guys, for those of you who don't know, hospice is when you have less than 6 months to live. So it was a very expected death, but it was still difficult. Like everyone knew today, today was his like last day. So we knew that so that was my first experience, like patient death experience. Was I was right off the orientation, brand new nurse. He was my patient. I think like week 1 or week 2, and expected, but it was so extremely difficult because just the whole experience. You just like seeing someone die right in front of your eyes. And then this whole post-mortem care, what you do with the patient after the death, the whole process was so like scary. It was difficult emotionally. That first one stayed with me for like months and months. I came home like in shock, like, my body was in shock. I don't think I shared with anyone for the first few days. So it definitely stayed with me for, days and days. I guess you just go back and, I would talk to my colleagues. It just, for that first one, I just needed some more time. It just, fades away with time. It was difficult. So that's like pre-COVID. But with COVID, that was like a whole new level. So every single day, this is just my floor, like 2 to 3 deaths every single day. Not like my own patients, but, on our floor. So that was like extremely difficult. That was like, you're like tearful. So those are not anticipated deaths. Like somebody is like, you'll be talking to someone in the morning, chatty, afternoon is like drop dead. So that was difficult. What did I do for coping? I guess I'll just, just take time, just accept the fact that, these are difficult times, and people die. It's inevitable. You talk to your colleagues. Yeah. Malika, have you had any recent death experiences with your patients?
I mean, we had deaths maybe when COVID already kind of passed, like sort of, like personally for me. And my first one was when I was actually orienting. We were just getting report and on report, like on change of shift, patient actually expired. And the guy was, I think, on CPAP. And we, I mean, I wasn't there for for the body itself, to see it. Like my preceptor prepared it. So I wasn't exactly over.
Okay, I think Malika had something to do. Yeah, it was definitely difficult. Like the insane amount of deaths I have ever seen in my life was during COVID. I actually had to take this is like a little terrifying. I didn't want to say this. This wasn't in my plan, but I had to take like at least 2 to 3 patients to the morgue, and that was actually more terrifying. To just like, I was alone with the transporter guy. So my patient died. I had to prep my patient, the whole process, put them in the bag, put the IDs, the name tags everywhere. Only me and and the transport guy, we had to wheel the patient down to the morgue. And that actually was like the most difficult thing for me, just seeing that whole pile of people in the bag. Like you can't even count, it's that many. So it's like a huge refrigerator kind of morgue place, in a white bag full of dead bodies. So that was like that stayed with me, that I can, every time I talk about this, it still brings back those terrifying moments. I don't think it ever goes away completely. Like every time I remember my patients dying, I fully it comes back. I think it's really on, and your patients need you. You just need to be strong. Like after that morgue, I had to come back and care for the other patients, and you still have to smile. You still have to help them. So it's difficult, like I said, but you just have to, you just have to go on, get up and do your work, because you're responsible for somebody else's job, life. You can't just sit in a corner and sob, or come back home. You just have to get up and keep going. It's definitely not easy.
Yeah, thank you so much for sharing. The reason why I brought this up was because while I was volunteering at a hospital, there was this like emergency case that was wheeled into the trauma. The patient had actually like died, and I was like right in front of the patient, and that made a lasting impact on me, and it kind of made me kind of go against medicine, because I really didn't want it to kind of like face that or like deal with that in my future, as a career. And so one of the things that I did was to kind of like take classes about death and how people deal with death. And that extremely helped me. And one of the coping mechanisms, you say that you didn't really like, you don't know what coping mechanisms that you use. Actually, you talking to your colleagues was actually part of the coping mechanisms. And every time, like, sometimes I share this experience with them just to kind of like make it easier on me to kind of like, okay, death is inevitable.
Yeah.
Thank you for sharing.
Yeah, exactly. Thank
Sorry,
you.
I had to disappear, you guys. Sorry for interrupting. I mean, I can't say that deaths in the hospital affected me a lot, because I kind of separated myself from them, because I know that they're very sick, and I don't know, maybe I'm a little bit, I mean, I can't say I'm cold, because it does touch you, because when you come back home, you kind of dream of like what you're doing at work. Like I have dreams of what I'm doing at work. But I kind of separated myself, because I told myself I have to be strong, even though it's a very scary situation. And as Nilufar was saying, because I was listening in my headphones, you do have to really, you see that dead body, you have to clean it up, you have to bag it, you have to tag it, you have to do, you have to call like a specific hotline if in case they're on a donor list. And then all the postmortem work, like paperwork, you gotta call the doctor so that they pronounce it. And by the time the doctor comes, they ask you, they're like, okay, when did the guy pass? And sometimes it's difficult, sometimes it's not, I would say, but I only saw maybe 2 deaths in total. I had a lady who came in to die, basically. And she was so small, and she was just, she was ANO 10-0. Like she was not alert or oriented whatsoever. She was just, she passed like within 4 hours after coming to my floor. And that was, I mean, it was sad, but I was like, okay, I have to take care of my other patients. I have to be strong for them, because otherwise nothing's gonna get done,
Yeah, that's true. But Ikhtiar, I know you said that kind of discouraged you, like seeing death, it discouraged you from, going to healthcare or medicine. But you also have to understand that death is a very, very small part of what you will be doing in the future. There's so much more that you'll do. That's not the biggest part. I mean, you'll see deaths, in your career, obviously, if you choose to go in this route, but you will also make a huge, impact. You make huge impact in people's lives. There's so much more rewarding, exciting part, into healthcare and nursing or medicine. It's just a very small part. And eventually, like Malika said, you'll be able to like separate that, from your feelings, from your personal life. It will just come with time. Like in the beginning, it might be, maybe a little too emotional, but eventually you'll learn. You just get up and keep doing what you're doing. But there's so much more into that. It's not only that. So don't be discouraged. There's so much more exciting stuff.
Absolutely. Thank
Yeah.
you.
Yeah.
I wish I had somebody tell me those back in like 2 or 3 years ago when I did that. But yeah, I'm still within that kind of like meta field, Thank you, Gary.
Yeah, thank you.
Sorry, quick question. So do you think it's a smart idea for me to before I go into nursing school, like should I take practice by becoming a paramedic and then see if I like that and then go into nursing school? Because that's what I was like, my original plan was to become a cop, but then at this time right now, cops are getting hated on. So I put that on pause for a second, and then I was thinking maybe becoming a paramedic, and then if I like doing that, then either I go back to being a cop or go to being a nurse.
I mean, I would set my focus on one goal. Like when you're ready, you have to make sure that you know what you really want to do, because being like going back and forth between nursing and being a cop, but those are two different things. Like you're still serving, the people of New York, but it's still, it's a little different. But I would recommend being a paramedic. Like you can see what they do. But I mean, I've seen paramedics because I've been to the emergency room, and when I was taken to the emergency room like by paramedics. The thing is, some of the practices that they like how they do it things is a little bit incorrect from what we're taught as nurses. Like for blood pressure, you take it on one arm and you measure your SpO2, like the amount of oxygen you have in your blood, right? That's what it was, right? And heart rate on the separate hand, because it will give you a very inaccurate reading, but they put it on the same hand. Don't do that. That's my first lesson for you. And that's what my preceptor was like, do not put it on one arm. You're not gonna get the same reading. After that, I was solid.
I want to be a cop. I don't mean like I'm gonna stick to being a cop. I was thinking like my biggest goal, like is like a body, like working the FBI as like a body investigator, like how they. So I was thinking.
Forensics?
Yes, forensics. There you go. So if nursing doesn't work out, I could just deal with dead people instead. The correlation between that.
I mean,
it's a joke.
It's up to you.
But also, yeah. So I think like me and Malika are bedside nurses. So that's direct patient, nurse and patient, care type of nursing. But let me tell you guys, nursing is one of the professions that has endless subtypes and subspecialties. You can be so many other types of nurse. You can do so many other types of nursing. There's just like literally so many. We're just we just work in a hospital in acute care setting, direct patient setting. But I know there's case management. You basically you don't even have to work with sick people directly. You can do like what else, like forensic, like you said, if you're interested in that area, forensic nursing. There is if you're into there's nursing informatics. There is nursing administration. If you're into administration, there's like nursing leaderships. You can be in like leadership positions. What else? I know there's so many. I just like can't.
Education.
Yeah, education. You can be like nurse educator. You can teach. nursing students or like nurses in a hospital,
It
nurse
can be a preceptor,
advocate.
like a
Yeah.
specific one.
Yeah,
Yeah.
there's so many. There's so many
much.
nursing you can do without being in contact with sick people. If you think that's not for you, yeah.
I have a quick question, guys. Before I want to say that, I want to say thank you to Ms. Salimova for organizing Akmal's birthday. I think it was very successful, so thank you for that.
Fun.
Yeah.
But going back to nursing questions, I think you guys talked about, it's amazing how you guys talked about 2 different pathways you guys took towards nursing. And obviously everyone takes a pathway, but looking back, if you were to advise, I know there's a lot of accelerated programs within nursing and PAs and anything in the medicine field. Would you guys advise doing accelerated programs, or like what's the pros and cons of those 2? I'm sure there's a lot of younger, probably perhaps somewhere in high school, and I think it would be very beneficial for them to know all the possible pathways and which one's more efficient. So if you guys have any info on that, feel free to share.
So there's a like those are different things. It's not which one you choose. It's based on your situation, which one is right for you. Accelerated is a 2nd degree program. It's not the route. It's not like a traditional route. It's, let's say if you have a bachelor's degree in psychology and you just decide psychology is not for you, you want to do nursing, accelerated is for you. Like that's like a 2nd degree program is accelerated. So you basically apply, you finish all your prereqs and you go to nursing school and you get into accelerated program because you already have a 1st degree in something else, something other than nursing. There's also a traditional route. You just start from scratch. You take all your prereqs. You do not need any degrees for that. You just take all your classes, required credits, and then you start the nursing program in the college you choose. I'm not sure if that's what you meant.
No, recently, probably, but recently I heard about these programs, and like in medicine, I know there's something called like Sophie Davis, where it's like a 7-year program into med school, which is obviously more efficient and faster. But also I heard like a lot of the PA schools also have the 4-year program where you don't have to go through all these like the bachelor pre-med stuff and just go straight into the program. Like do 2 years of pre-health and then just do 2.5 and 3 years of upper school. And obviously that's an option for someone who's already decided. And let's say if there were people that are decided into what they want to do, would you guys recommend those programs, or do you think they're like very costly? The pros and cons of those 2.
I mean, when I was in high school, I was in biomed, and they actually my advisor tried to get me to apply to Sophie Davis. And when I realized that I would have to take on regular courses and pre-med courses all at the same time, you're a senior in high school, you don't know what you're doing. Like you may have initial dreams of like, oh, I want to go into med school. Like my initial dream was to go to med school, but then you realize it's like might not be your calling. It also depends on how much workload you can handle and your life situation, and your time management skills are very important in this case. As Nilufar said, I do agree, like with 2nd degrees, it's very different. Like maybe you had a change of heart, like about the current degree that you're in. Maybe the job that you're doing is not making you happy, or you decided to take a trip, like volunteer with the AmeriCorps, and you see how people struggle around the world, and they see how the nurses are taking care of them. So maybe that inspires you to become a nurse, and you go back to school for a 15-month program, which is it's better for us, and we can get to our goal faster. But there are programs, I know within the NYU, I think there's a 4-year nursing program. I know somebody who's my classmate, she graduated from nursing school from NYU nursing school, she did 4 years, and she, I don't know her particularly because my DNP class is split between those who already had experience and my class who went straight after we got our masters into the DNP. So it just depends on your life situation. But Sophie Davis is a little bit more intense. Like, I wouldn't recommend it for the faint-hearted. Like, if you have a lot of anxiety right now about school, I wouldn't recommend it. If it's easier for you to go through a nursing program that's like 2 years in total, not like 15 months or 4 years that you've decided on, like as a freshman in high school, go ahead. Otherwise, just just know what you want to do off the bat if you're doing 4 years.
On that note, I know some people might be wondering if the 2 years nursing program, the associate's degree or the bachelor's degree. I get this question a lot, like these kinds of questions a lot too, like which one should I do? What do you recommend? Should I do associate's degree first and then later do bachelor's? So I know this is a group of, young people. So I always say 100% go for bachelor's. I think like soon they will require all the associate holders to go back to bachelor's eventually. But if you guys are considering nursing and thinking about whether to do associates first or just do like bachelor's degree, BSN, do BSN 100% and focus, focus in that route, like the prereqs and stuff. I know there's an option if you're already in the associates program. I know they have some kind of fast track like RN to BSN programs in some schools, but if you're deciding between the two, go for the bachelor's 100%. It's worth it. You'll have more options, in terms of the career. I'm not sure if that was, part of your question, but I think Malika covered the Sophie Davis question, which I have no idea about.
Thank you guys, very insightful.
Anytime.
Anything else?
There's actually a question.
Good evening. I have a question. Hi.
Go ahead.
So regarding clinicals, since due to COVID, currently we're not having like enough amount of clinicals. Is it going to affect us in future as we work as a nurses?
Yes and no.
Yeah. Because from what my friends who were in the cohort below me have gone through, they didn't have their capstone, which is where they're working directly with one nurse. But like you're not partnered like with two people. You're just like shadowing like one nurse all around like for 6 weeks. Like based on her schedule, you do 12 hours with her. That's what they missed out on. But the thing is, now schools offer simulation labs that you can go to and make up your hours. But that was during COVID. Like you can do sim online. Like they legit have like simulation programs that you can, like a software that you download and you go into sim. Like that's what, we did simulation just as like for like standardized patients. We also did Zoom with standardized patients as providers. And you can still salvage that. But when you put it on your resume, you won't be able to put it that, oh, I actually did my clinicals on Zoom. I did my clinicals on SIM. You can't really put that down because schools require you to have, like my school required me to have over 1,000 hours of clinicals. And we listed them, you know, for, you know, it looks nice on your resume where you went. Because they're like, oh, you did it in this hospital and you're applying here. Oh, that's so nice. You know, it kind of helps boost you up. But otherwise, I don't have a solid answer for you. But right now, clinicals are opening up for nurses, but you're not going to be there as often as you would want to be.
But you'll get, was that Sitora,
Yes,
right?
right.
Okay, besides Sitora. So you'll get, or wherever you get hired, you get training. So just, you know, they're not gonna just throw you, you know, hold on. So you get 2 to 3 months of training, you know, whatever place you work. And your colleagues, you know, your manager, the people there, they know that you went to school COVID and you need enough clinical experience and stuff. They'll be very understanding. We're getting a lot of nursing students who, you know, who did most of their clinical experiences, you know, via Zoom. So we know that they will know, but I think you'll get enough training. You won't be just thrown, you know, to nursing field without knowing anything. You'll get training. You just have to like absorb everything, you know, in that short period of time. But you'll get a lot of support when you start like working as a nurse. So I think you'll be fine. Just, you know, just try to absorb whatever they're teaching you now. Just try to absorb, you know, understand what you're doing, participate in your, you know, like Zoom simulations. Just try to learn as much as you can. But you'll get good amount of training at a job.
Oh, thank you for the clarification, because currently I'm in my junior year of completing the BSM program, and I was a bit well, how can I explain, like nervous, since we're not doing the clinicals like hands-in. So
yeah,
you'll be covered, as Nilufar said, at your orientation. The preceptors that they give you, I was very happy with my preceptors because they really teach you what to do. They really want you to succeed. And the charge nurses are always there to help. They will always have your back, like no matter what, because they know you're new, they do it themselves. So you have as long as you have a good support system at your workplace, no toxicity, you're gonna succeed as a nurse.
thank you.
Also, I'm so sorry to interrupt, but there is this opportunity and free clinical shadowing opportunity that I'm taking part in that this program called HEAL offers. And although this may be different from an actual clinical experience with hands-on things, I think it's still good to get the exposure, to have an idea of how to run through a patient's, I guess, situation, with learning how to diagnose a patient given their symptoms, learning how to come up with solutions given their situation. So Sitoroiti, I think I can email you the opportunity or send a link in the chat so everyone else could check it out, and they're completely free. So yeah.
Thank you, Noila. I would
Of course,
appreciate
yeah.
that.
They do sessions every Wednesday at 8 o'clock, and it's usually 1 hour, and it's like so informative, so insightful. So yeah, I'll share it.
Are the diagnoses for nursing specific or just medical?
Just medical, yeah, healthcare in general.
Okay. Okay.
Last Wednesday, I think it was, I forgot what it was called. Akamaka, do you remember?
Appendicitis, diagnosing
Yes,
appendicitis.
Yeah.
Yeah. Here's the deal, guys. And Nilufar will back me up. We do not diagnose as nurses, guys. We do not diagnose. We do not prescribe medication whatsoever. We have our own nursing diagnoses that you will learn about if you go to nursing school, but you do not make a medical diagnosis for a patient. You don't tell them, oh, you actually have a GI bleed, or oh, you're actually, you
have appendicitis.
Pulmonary. Yeah, you actually have pulmonary edema. You have CHF. You do not say that to them. You how you will log it as fluid overload. Like when we have Epic system, and Epic system works well with us, and they let us chart the care plans based on nursing diagnosis, not medical. So I just wanted to clarify that for you. If you're going for an NP, that's when you can diagnose. You can prescribe, but you're also restricted based on the state that you're in, and you might be working either independently or you might be working under an attending.
Yeah, 100%. Agree. Any more questions or?
Oh, I think we had a question from a little bit ago. How many years is the nursing school, and is there any psychiatric or clinical nursing? I think they wanted like specifics.
I guess it depends. Like nursing school, like I said, if you choose the traditional route, you're right out of high school. And if you want to do bachelor's in nursing, I'm gonna say it takes somewhere 45 years with like all your prereqs and classes and all that. 45 years. But if you have, like we mentioned earlier, if you have a degree, bachelor's degree in something else, and you want to do nursing, I will say maybe about a year of prereq courses, and then 50, if you go to accelerated program, 15 months of nursing itself. What else? If you want to do associates in nursing, you're fresh right out of high school, then it's 2 years, 2 to 3 years, I think. Bachelor's is 45 years. Second degree, 2.5 years. Yeah. And psychiatric, what was the question about psychiatric clinical nurse? And is there any psychiatric? Yeah, absolutely. Psychiatric nursing is like a huge field. There's psychiatric nursing. Clinical nursing is, I think it's what we do, like bedside nursing. It's clinical nursing. Yeah, so as a clinical nurse, you can either work in the hospital, depending on what floor you work, and that's specialty floors, or you can work in clinics, you can work in doctor's offices, urgent care, I think, if you don't like the hospital setting. Yeah, there's a lot of clinical nursing types.
Okay, so far that's the chat question.
I
You're
have
welcome.
a
Go ahead.
My name is Sadukat, and I'm currently a freshman at Hunter College, and I'm pursuing like my major is neurobiology. And I have a question. I have a cousin. She's at work right now, and she asked me to ask those questions. She graduated from Samarkand State Medical University, Institute, and she got the degree of pharmacist. And now she came to United States, and she wanted to go to nursing, but she doesn't know from where to start. Like, should she evaluate her degree or what she has to do? If you know, of course.
She's, I guess, first, depending on her level of English, that's like the first thing to start. I know we have a lot of people with degrees in medical and healthcare field that come here. Obviously, that's the first thing they have to do. If she comes with like 0, from the beginning, then she should start taking English courses. And the next level would be submitting her documents for evaluation and see what credits will be transferred from that Samarkand Medical University to here. They basically evaluate all their courses and credits. Then I believe I actually have to research on this. I think they, not for the medical, not for medical school, but I know for some nursing schools, like med colleges in Samarkand, I know they're able to get their degrees evaluated to like US level of associate's degree here, and they can just take the NCLEX and have the NCLEX license and associate's degree, international associate's degree in nursing, so something like that. But for bachelor's, like going back, they have to do all the prereqs and take the NCLEX, go to the bachelor's program here in school. But yeah, I guess first is language, English. Then she should submit her documents for evaluation. I'm sure there are like a few companies that do that. Their websites in Google. So evaluation. Then she reviews her credit courses. If she wants to do bachelor's, submit the credits to the college that she wants to go, and take the NCLEX. Do you have any experience with that, Malika? I don't really have a lot of information on international, process, but I need to research on that.
I mean, I've been here in the States for 15 years, so I don't know. I've been here since I was a kid.
That you helped with, or people you know? No, okay.
No, I mean, one of my friends, actually, he went to med school in Georgia, like the country, and he had his credits like officially recognized, I guess. Like he had a transcript that he showed me, like directly from the school, but I don't know if it counted in to his nursing degree because he took everything that I took, like equally, even though he had a first degree as a doctor. So I don't know for sure how it would transfer out.
My dad, he used to be a doctor back in Uzbekistan. So now he's a nurse, a registered nurse. So I'm pretty sure he got his his degree to transfer here, and then after that he had to take more courses and to retake the nursing test. So that, if that's what you want to know, we have to first, like she said, you have to get it reevaluated, and then you have to go to a nursing school. Like you could do any of them, and then you have to retake the exam, and then that's when but you don't have to go through all the other steps that like not new, like American steps, like us have to go through.
Yeah, I mean the NCLEX is very specific to the US nursing system, so that everyone has to take to get a license here. But like the prereqs credits, all like pre-NCLEX stuff, some of them can get transferred, evaluated. I guess that's a very like case specific. She won't know until she submits her documents for evaluation, get the answer from them.
Thank you so much.
No problem. Anything else?
We have some time for more questions if you guys want to ask them now, if anything pops into your mind. Because we are here for you.
Okay, well, we have something in the chat. Oh, that's Akmal, I think.
Yeah, that's just a better.
Okay.
Pause it.
Yeah, okay, Akmal. Akmal tried to answer the question about the evaluation, I think. If you guys come up with questions later, you're more than welcome to message me, DM me in Instagram, or I can leave my email here if you guys prefer email. I'll be glad to answer any questions. I have some NCLEX resources. I can share them for those of you who are taking NCLEX in the future, or anything. I can answer questions.
Okay, we have a couple of questions in the chat that we can answer. How long did it take us to be confident when we started the first job? I will say it's a work in progress. Either way, I mean, I'm new. I'm fresh meat basically, so it takes. You still, I still ask for help. It's not a fault to ask for help. Even experienced nurses ask for help with some things. Maybe they weren't trained in something like in their own time, or they haven't encountered it. Maybe the practices have changed. But as long as, you pace yourself while you're doing your job, while you're doing a med pass, while you're giving an injection, while you're hanging an IV, like a bag of saline or medication, or you're in a rapid response, just, try to have a clear head. Don't get distracted so that you don't make mistakes that can cost you, a lot.
Yeah, they say everywhere, they say it takes about 6 months to be comfortable, to be confident and comfortable. But I guess, like Malika said, it really depends on yourself, on your own pace. Everybody has a different pace. If it takes more than 6 months for you, that's okay. You just have to, keep going. Just, stay focused. Just absorb everything. For me personally, oh God, I don't remember exactly how long it took me. Maybe like 4 to 6 months. I like Malika. I had great preceptors. I had such an amazing, group of nurses where I worked. So I guess it depends on that. Depending on the support you get from your peers. But to be confident in what I was doing, maybe like around 6 months. I mean, not that you want like. You will be good, it's not that it's not that you're going to be a bad nurse before 6 months, but I would say it takes about 4 to 6 months to be like comfortable at where you're doing. That's how much it took me, I think. But yeah, it's like nursing is a lifelong learning. You're always learning. Like I've been a nurse for, almost 5 years, and I still go back to policies. I still go back to review some stuff, some of the diseases that, I don't get to see too often. I still go back and read. I'm always like, every single shift, I'm learning something new. I'm always researching something. I'm always looking up stuff. I'm always asking, those are the nurses who are more senior than me. I'm always going to them for some questions. It's lifelong, that's nursing. There's always new stuff, new situations, new cases, but in like 6 months, you'll be pretty comfortable.
Okay, and the last question that we can answer this time, it says, can the nurses be doctors one day if they decide to change their careers? Absolutely. Absolutely, you can be a doctor. You have so much practice. You have so much going for you. Just take like a couple extra classes, prepare for your MCAT, and go to med school is going to be probably much shorter if they accept like more credits and see all your certifications and all that you've done. Maybe you've been published. I'm pursuing a doctorate in nursing, like as a nurse practitioner, so I will be a doctor of nursing practice. So holla.
Dr. Malika Mirsagatova, to be soon.
I'm
Yeah,
I
have a friend in med school right now. We used to work together. She was a nurse. She's in med school right now, and she had to take like a year or two of, maybe a little more. But yeah, you definitely have to take some like pre-med courses, the ones that you didn't take in nursing school. But you can be anything in life, guys. If you're not happy about anything that you're doing, just go back and do what you love. You can be anything. You can be a doctor. You can be anything. It's just you just have to stay committed. Maybe there's a little more work in some of the things that you want to do, but it can be anything. I heard, I'm not sure if it's true, but I think it will make you a little more competitive if you're a nurse if you come with this huge amount of healthcare experience. That's what I heard. You'll be a little more competitive actually if you decide to go to med school later, and you will I know 100% that doctors who were nurses before are amazing
Much
doctors.
nicer.
They're just so good.
Yeah. Like no offense to our future doctors here, and PAs and whoever wants to boss us around in the future. Just make sure that you are communicating with your nurse, because communication is key in patient safety and patient care, and getting the treatment quicker and getting the patient out so that there are no delays. Because delays in communication and miscommunication can have not such great consequences. So if you yes, you are above somebody in a degree, you can do certain things that we can't do, but also know that we are human beings, and we're a team. Most importantly, you're a team with the doctors, nurses, PTs, RTs, anesthesia, social work. You're all a team. You're working for the patient, so you're not above or below anybody. And that's why sometimes I see that in doctors, like who actually talk to you, and I see those who think that they're above me just because they went to med school. So it's important to have good bedside manners. And that's the thing I love about nursing, is that we have great bedside manners. And that's why NPs are loved, because we know our patients. We want to get to know them. We want to be there for them. So always try to look at a person, try to look at your patient as a person, not a disease that you have to treat. As a person, you have to think how they are mentally, emotionally, physically, and everything else in between.
Yeah, 100% I agree with Malika. Nursing is all about like holistic care. It's not only about, okay, you came for appendicitis, let's just fix your appendix, send you home. That's basically what doctors do most of the time. They just fix their appendix and then send them home. But we're there for 12 hours. You just become, we're become like family with patients. We're there from morning to evening. I connect with you on a personal level. I know who you are as a person, as a human. I know so much about you that doctors don't. They only interact with you like 3 to 5 minutes a day, after your surgery. That's why it's so important for nurses to communicate with nurses. I think at NYU that we have like amazing nurse to doctor communication. They respect nurses a lot. That we're always talking to each other. Whatever plan they want to make, like treatment plans they want to make about patients, they're always calling us. Hey, who's the nurse for this patient? We want to do this for a patient. What do you think? What's your opinion? I think they're so good at that. That's why I love NYU. But yeah, it's so important to talk to your nurses in the future doctors. They know your patients. They know some.
We know them inside out.
Stuff.
We know what comes out and what goes in.
Exactly.
Yeah, and I remember actually last week or so, or 2 weeks ago, we had a patient come in, and this doctor is like, so what, like should I put a nursing communication in this, or what orders do you want me to put in? And I just looked at him like, what do you want me to do? Do you want to put the patient on DVT prophylaxis? Do you want us to do Q4, Q8 vitals? If you want me to do that, just put on the order. He's like, do I need to do nursing communication? I'm like, no, just put on the order. He's like, oh, I'm covering 4 hospitals. I'm like, congratulations.
Yeah, we get that a lot. Like new interns, new residents, they're always asking, which is great. I think we especially the senior nurses, they come and ask for help. They're like, oh, you know what, this is my patient's having chest pain. I'm a little nervous. Can we do something? I'm like, yeah, you put this and that. So for a lot of new doctors, they're great. A lot of times.
All right, guys, we have a minute left. If you have any questions for me or Nilufar, just hit us up on Instagram if you want, or I mean, I'm on WhatsApp in the group. Nilufar, are you in the WhatsApp group?
I don't believe so.
Akmal, why don't you add your sister? What is wrong with you?
Sorry, I'll add her.
Yeah, so you can hit us up there if you have any last thought questions. Oh, yes, you do need a good GPA.
Yeah, needed for
Like,
to get into nursing program. Yes, for nursing program to get into nursing program. Yes, of course. To apply for jobs. Yes, yes, and yes. Some hospitals have like a minimum GPA requirements. Like NYU has 3.5.
What's the GPA we need to have? Sorry, she was asking what we need to have as a GPA in the nursing school.
To get into nursing school, or to apply for jobs.
School.
To get into
nursing school.
I believe they require at least 3.5. It really depends. It really depends on nursing school.
Yeah, I mean, I know downstate when I applied, their requirement was a 3.3 or above. And for Columbia, they changed the requirements because they're master's doctorate. They offer a GPA if you have a GPA of 3.25 or above, you are exempt from GREs, which are the grad school exams. But it's best to still have a competitive GPA. If you don't have a competitive GPA, have a very competitive personal statement and competitive background.
Yeah, there's so many things that, there's so many ways you can sell yourself, put yourself in the market for nursing school, but GPA is definitely one of the biggest one. Also, like Malika said, there's personal statement. There are other things that you can show, like if you did like volunteering or shadowing, like if you did some kind of research in healthcare, put all of that, it all comes in a packet. They never look at you as, oh, this guy's GPA is 3.0, that's it, he's like automatically out. They look at everything, they look at you as an individual applicant. If you have other strong aspects of your, application, they'll definitely consider that. But yeah, like I guess minimum of 3.0. The higher the better, always, of course.
Yeah, and here's also a thing for our male our males who are interested in nursing. Nursing schools are really looking into taking on boys.
Yeah.
So you actually have that advantage as a guy if you want to apply to nursing school. But in my graduating class, we had about 20 guys out of 200 students. So, and that's because the pool was mostly female. But guys are also encouraged, and they are hired in high acuity or high acuity floors because you have the manpower, you're strong, you can handle it. Like they have some heavy patients, guys. That's why just come to our medical surgical floors and help us, please, because I can't move those people. I'm only 105 pounds.
Yeah. Yep. There's a high demand in for male nurses. They call them nurses. I just found out nurse.
Yeah,
male
yeah.
nurse.
Like I get a little bit salty over it, but downstate rejected me. When I will say I had a 3.8 for my graduating GPA for my bachelor's. I applied to downstate. I was rejected. A person with a 3.2 got in. It was a male. So you can see where things are. Sometimes they want to fill in the demographics. Sometimes they have their own requirements. Maybe you're underqualified, maybe you're overqualified. So they just like, go find your own path.
Yeah, that's true.
Okay. Well, we are a little bit over our time, but yeah, as we said earlier, just message us. We can post it up in the group chat, our emails, if you want to have an extensive conversation. chat us up and we will, we will try our best to answer your questions again.
Yeah, I'm open to any questions as well. You guys send me your questions in the group chat or Instagram. But just to wrap up, I want to tell you guys that nursing is definitely one of the challenging paths, one of the challenging programs out there. So there will be days that you'll be so overwhelmed. Like nursing is not for me. There's just too much work. Too much requirements. Too many clinical hours. Just stay focused. If you really want to be a nurse, let me tell you, it's so worth it. I'm so happy. Like I don't want to do anything else. It's extremely rewarding. I love what I do. But nursing school was tough. You just stay focused, stay committed. You will love it at the end.
Yep. Okay, I gotta go, guys. I gotta eat food because I haven't eaten. I only slept at 1 o'clock.
Thank you, Malika. Go eat.
Thank you, Nilufar, for your company. I'm glad to meet you again. We only chatted like once. For your brother's birthday.
Yeah, same. I'm glad to meet you too.
Okay, guys, this is it. Enjoy the rest of your weekend, and we will see you in the chats, and we'll probably see you guys on our Instagram pages.
Thank you, everybody, for joining. Thank you, Malika. All right, moving on. We are going to try to have more panels for those who are looking to go into other fields aside from nursing. We'll try to reach out to dental people in the dental profession, medical profession. So just to tap into those fields also. And if you have questions, definitely email them. Nilufar, did you put in your email? Just put your email. And you can always contact us on Instagram or Facebook or our website. Shoot us any texts. And this turned out great. So we may do this again later on if you're interested. And next time, do come with questions. More questions. So thank you. I will stop the recording and that should conclude our session.